Hi, this is Doug from Rise Above Performance Training. Today I have a special guest, Jeff from Move Well Physical Therapy, and he's an expert on sports rehabilitation and also corrective exercise. So I've been getting a lot of questions about external rotation of the foot or leg and exercise, which is just turning the feet out. So I've actually been taught to squat with a slight turn out of the feet and squatting. And I've had some people tell me that it's right and some people tell me that it's wrong. So we're going to go to the expert today, and he's going to give his thoughts on that. So Jeff, what is your thoughts on external rotation of the foot and leg?
Yeah, for the most part, when I evaluate a functional squat test, the first thing that I notice is what's going on at the ankle. So when someone squats, the first thing that I look for is whether the foot's pronated, inverted, or whether it's in neutral. If it's over-pronated, a lot of the times that'll accompany internal rotation of the hip or the femur, and also what's called the valgus stress test, or valgus angle, where both knees are buckling towards each other. A quick and simple way that I'll show you later on in this video is to adjust for subtalar neutral. And with a few palpations and with a few visual and verbal feedback, I can have a patient or a client neutralize their footing, which eventually and ideally will correct the lower kinematic chain. So we'll go ahead and have a little bit of a assessment on Morgan here and show you visually what that will look like.
And before we start, do you think people do rotate outward to compensate for hip immobility or for that kind of valgus sort of stress? Is that why people do it?
Yeah, it's a combination of both inflexibility and also weakness. These are all normal compensatory patterns that patients and clients have. Especially when they're doing a squat or something that's a little bit more challenging.
Yeah, because I noticed for myself, I mean, I've had knee surgeries on both legs, and this foot likes to turn out a little bit more, so I try to keep it in more now, but it does like to move out more, and I try to, like I said, do those corrective exercises to keep them more neutral.
Yeah, in addition to that, you can isolate, if it's a problem area in one side versus the other, you can always isolate it with a single leg lunge or single leg squat. It doesn't always have to be neutral, although end result is you do want balance within and between the two extremities.
Similar to the movement pattern.
Yes.
Okay, great. So we're going to do the assessment next, and we'll take it from there.
Okay, so here we have Morgan. She's going to be our subject with regards to me correcting, we're looking for subtalar neutral. First thing I do in the clinic is have them do what's called a functional squat test, which is basically, I cue her, I say there's a 10-pound box in front of you, and what I want you to do is do what you normally would as regards to picking up this 10-pound box. Look at her from the front and also from the side. So go ahead, Morgan, and pretend there's a box in front of you. Pick up that 10-pound box, and I'll have you do that 3 to 5 times. Let's see what we find here.
What's that?
We're looking for any deviations into pronation or supination in the foot. It's just looking pretty good so far. There's no major collapse of the medial calcaneus towards the midline, so not much to correct. But let's just say, for demonstration's sake, that when she squats, her foot deviates completely inside. And again, you notice a couple of things going on here. Medial deviation or deviating of the knee towards the midline, a little bit of internal rotation of the hip. So a lot of the times what I'll do is I'll use my index finger and my thumb and I'll palpate the talus in the front of the foot. The talus is sort of an incongruent joint, so you have to sort of measure for that via rocking the calcaneus left and right, or what's called here inversion and eversion, until you find that the surface of the talus fits nicely between your index finger and your thumb. It's not the most scientific way of doing this. In videos and also in the clinic, if I were to be a little bit more precise, I would mark where my index and thumb fits. Again, that's where the talus is. Felt on both sides. and also the second metatarsal bone. And I would mark and indicate the midway point between where my thumb and index finger is. And then drawing a vertical line between midline and the second metatarsal, and locking that up with the midline between the tibial crest. And for the most part, subtalar neutral will indicate a vertical line on tibial crest and also on the mid-tarsal, and also bisecting with the subtalar neutral. So visually, now you have a cue as to what to look for when she's squatting, and any deviations inward or outward is a deviation away from subtalar neutral. So let's look at Morgan's squat again. And again, she's holding it pretty well. Give it a little bit of tactile feedback here. One more time, Morgan. Okay, so a number of things you get out of this. Visually for Morgan, we would have her do this in front of a mirror so she can see that line. If she was very, so to speak, out of control with regards to subtalar neutral, I would also have my hands here to guide her through the movement. And in addition to that, we will go from doing what's just an assessment and or a screen to having her do some more challenging variations of squats. So squatted weight, or what's called a wall sit, or isolating into a single leg lunge, or even a single leg squat. So all with the subtalar neutral in mind.
Tell about your.
Yeah, I'm good.
Okay. So where can we find more of you, Jeff?
Yeah, so my name is Jeff Lamb, and I work over in San Francisco at Live Well Physical Therapy. Thank you very much.